Dear fellow colleagues, I introduce myself as Tarun, currently working as Program Coordinator, Masters of Science in Pediatric Dentistry at College of Dentistry, Ajman University, Ajman, which is located in United Arab Emirates. I'm here to introduce and provide you with an insight for the OXIS Calibration website. Lots of effort, time, and energy went into to convert the idea of Professor Muthu into reality, that there should be an online platform where the practicing clinicians and researchers can seek appropriate knowledge, minimize the overload of material, optimize the efficiency of calibration, and provide repositories for clinicians, healthcare workers, and policymakers. This is for the first time that this OXIS calibration portal is being introduced among the scientific community. This site has been developed in collaboration with Ajman University and Shri Ramachandra Institute of Higher Education Research, Chennai, India, as both institutions carry shared vision of knowledge, promotion, and retention. Actually, the portal has been created with an internal research grant received from the Deanship of Research and Graduate Studies from my university, that is Ajman University, and myself is the principal investigator for this research project that was titled OXIS Classification, a global collaboration for calibration and database management. There has been a fundamental change in the understanding of interproximal caries etiology. This process is now better understood and transformed. Contact areas between primary molars and their variation create complex microenvironments in between the teeth. This can potentially play a critical role in proximal caries etiology. Historically, contact areas in primary teeth have been described as broader, flatter, and situated farther gingivally. Traditionally, only two types of contact areas have been mentioned in the literature, that is open and closed. Cortez et al. In 2018 was the first team to categorize the contact area based on the shape of proximal surface of the primary teeth into four types, that is convex concave, convex convex, concave convex, concave concave, concave concave. And however, in Kirtiga and Muthu in 2019 proposed a new classification based on their studies on three-dimensional images of proximal contact through CBCTs. This was coined as OXIS. 3D images have also verified that contact areas only existed at one-third of the occlusal part of proximal surfaces in primary teeth. So, four types of proximal contacts have been classified according to the type of association between the two adjacent proximal surfaces. O contact when there's open or no contact between the primary molars. X-shaped contact is present when point of contact between primary molars is equal or less than 1.5 millimeter. If the point of contact present is more than 1.5 millimeter or straight contact between primary molar, then it is classified as I-shaped contact. Finally, when there is a curved contact between primary molars, then it is labeled as shaped contact. So these are the dental cast and the clinical pictures of OXIS in maxillary teeth. So you can see here of a O type, then comes X type, then I type, and then S type. Similarly, you can see the dental cast and the clinical pictures of OXIS contact in mandibular teeth, and there are different type of O, X, and I and S type of contacts present in different pictures. So why OXIS calibration website was required? In ancient times, the communication was people to people, which meant one to one. This changed to mass communication from 15th century onwards, and information was delivered through printed books, newspapers, radio, and television. However, in 21st century, the communication among human race has been revolutionized, and people are considered data and designers as well. So access to digital health information has expanded exponentially, with websites developed to target education related to myriad of health domains and problems. In the last decade, the proportion of investigators accessing e-learning healthcare websites have increased twofold. In fact, to name a few, in our own specialty of dentistry, web-based modalities have been developed and described from learners' perspective, such as International Caries Detection and Assessment System, popularly known as ICDAS or ICDAS website. Then we have International Association of Dentodermatology website, or for that matter, mobile app, Tooth SOS, and then Zero Out Early Childhood Decay mobile app is also available. So the OXIS Calibration website was created with the following goals: to create online tutorial system for identification of proximal contact, to optimize the efficiency of calibration among researchers around the globe, to identify variation in the proximal contacts of primary teeth early and apply preventive measures accordingly, and last but not the least, thereby potentially altering the international caries risk assessment protocols. So, while the objectives for the OXIS portal was to allow researchers across the globe to store raw data of their studies, to segregate data from different geographical zones, to store long-term perspective and retrospective cohort study data, and finally to consolidate global data and document it in a report form. So OXIS portal is oxiscalibration.com. It has advanced functionalities and is interactive and user-friendly for the researchers. The registration is free and available for all. The website also contains online videos, PowerPoint presentations, recorded lectures, and provision for interactive online testing and practice sessions. So, to develop this website, actually the web development framework was first defined so that the site features were clear and contents were more effective before the designing of the portal started. This slide actually summarizes the website framework. It consisted of 5 main drop down or pull down menus on the menu bar that allows the user to choose one value from the predicted or predefined list. First menu explained about the OXIS classification with historical perspective. Then comes the training menu with the calibration exercise. The third drop down menu have all the full published articles on OXIS, which are compiled year-wise and are freely available for the registered users. The second last menu list is on the frequently asked questions about the registration, calibration exercise, results, etc. And the final drop down menu is about the team and its contact details. So OXIS website was conceptualized into two phases. The phase one concentrated on website development and design, that further consisted of expert and focus group discussion. EGD, that is expert group discussion, was conducted over 2 months, consisting of weekly working meetings between the 5 team members via teleconference and email correspondence, where the development process was discussed and defined. The second stage of the portal design consisted of focus group discussion with 15 researchers and colleagues who were unrelated and had no prior information about the website. They were recruited from the 2 involved universities, and their recommendations were incorporated into the website development. While the phase 2 was meant for the domain registration and the development of the web portal. The domain, which is oxiscalibration.com, was registered on web hosting company GoDaddy. Design intent of the website and its usability was assessed through the prototype creation that acted as a stimulation on how a finished website will work, and also how the final interaction between the user and the site interface will occur. The site was first assessed by creating a low fidelity prototype. Basically, a low fidelity prototype refers to the level of details and functionality built into a prototype. Low fidelity also commonly refers among all the IT professionals as low-fi prototyping. It is a quick and easy way to translate high-level design concepts into a tangible and testable artifacts. Lo-fi prototype was checked and tested the functionality rather than the visual appearance of the planned website. The usability of the website was assessed through system usability scale, which was a 10-item questionnaire administered to users for measuring the perceived ease of use of web portal. The suitable assessment of materials, abbreviated term to use in short is SAM, was also designed to assess various website domains such as content, graphics, layout, type, font type, learning stimulation, and interactivity. Since lo-fi prototyping doesn't require a specialized skills, and even non-designers, non-expert, non-calibrated people could play an active part in the idea formulation process. 10 postgraduate students from two universities were involved for lo-fi evaluation. Paper prototypes were used to assist for low fidelity. Digital high fidelity prototypes, popularly known as hi-fi, was also developed that appeared and functioned as similar as possible to the actual OXIS calibration website. During usability testing sessions with hi-fi prototype of the website, that participants consisted of 8 senior practicing clinicians and researchers equally representing both genders. They interacted with almost the real website. They provided the meaningful feedback during usability testing in terms of user experiencing testing, functional testing, performance testing, security testing, device and platform testing. Finally, the effectiveness of the develop portal was also evaluated in terms of the website, whether the website was easy to use, has the purpose of the website has been met, has the website been well designed, is the site reliable, or is the site up to date. So few of the statements which we received for the participants of the focus group discussion included: one participant commented that if there were links to existing interproximal contact resources, this would enhance the researcher or clinician's knowledge. Another participant mentioned that after all, I still think this website mainly targets those who want to get calibrated on OXIS classification. The third participant mentioned that one will enter this page only if he or she wants to study on OXIS classification now or later. Basically, this was a general agreement with a lot of participants during the focus group discussion. And another participant said, also, even if it is great with all the links available for OXIS related articles, I don't think that you would visit the website if your primary goal was not to get calibrated on the OXIS. So, the few more examples on FGD, that is focus group discussion comments, participant comments, which helped us to modify the website wireframe. One participant said, my first impression was that the word database was mainly directed toward repositories. And another participant mentioned that I think the historical perspective section should come before the fundamental change section for those who are not well versed with the OXIS classification. I beg to differ in my opinion. The sequence seems appropriate. So there was a contrasting, views from the participants during the focused group discussion, which is very interesting, and it really helped us to modify the frames for the website. So this is the schematic diagram describing the process of development of high and low fidelity prototypes. Firstly, the website requirements were identified, followed by its creation through wire frameworks and storyboards. It was followed by conducting a focus group discussion. This helped us, as I mentioned, to create and assess low fidelity prototype in a paper form. Any new requirements, suggestions, changes were then incorporated. This was followed by a creation of high-fi prototype through questionnaires. Any required changes, suggestion provided by an expert group was then implemented. Now coming to the calibration of that is training exercise. The training to OXIS calibration is provided through the video that contain detailed explanation about the OXIS contacts. During the video, few pop-up questions appear that will help the participant to understand and grasp the concepts. After the training is done, then only the participant will be able to take the to take the calibration exercise. In the practice exercise, there are total of 20 questions. All MCQ questions have 4 options, of one of which is undeniably correct. The correct answer will receive 1 point. The assigned values for all completed responses are simply summed up and percentage is calculated. To pass the exercise, the candidate needs to score 80% or higher. The OXIS Calibration website is also dedicated to protecting the integrity of the calibrator's work. Therefore, one has to submit only original work and should avoid sharing answers with others, and also report suspected violations if any. So this is one of the multiple choice question from the calibration exercise. As mentioned earlier, there will be 20 questions in total, and the questions in the exercise are given in form of MCQs or true and false. This is how the result appears. To pass, the candidate needs to score, as mentioned, 80% or above. There is unlimited number of attempts. A person can take any number of attempts, but however, each time the person wishes to improve or retake the calibration exercise, another new set of 20 questions will appear, and again the person has to score 80% or above. This is how the one can view the results for the attempts. Okay, with the explanation is provided for each incorrect answer. Okay, this is an example of the certificate that the participant will get. Continuing education is an essential element in helping dentists maintain high standards and credentials. Soon, the OXIS calibration exercise will allow you to receive accredited CME learning credit hours from different governing bodies. This will assist dental professionals in identifying quality providers of continuing dental education. The result will be valid for 2 years only, and one need to calibrate again after 2 years as new information and evidence gets available. This portal also has a search options to locate existing users of OXIS calibration, and will also allow us to evaluate how many persons from which part of the world or which regions have calibrated. Research resources on this expert-driven website consist of availability of all related published literature on OXIS. All related articles are in full and freely accessible. This will expand as more clinical and research findings become available. So OXIS calibration team consists of 5 members. Myself and Dr. Raghavendra belong to Ajman University, while remaining members are from, that is Professor Muttu, Dr. Sneha and Dr. Kritika from Sri Ramachandra Institute of Higher Education and Research, Chennai. So the journey of 1,000 miles begin with one step. This is my last slide. To quickly recap, I would like you to remember these key points. The website offers flexibility, updated information, and also accommodate simultaneously changes in knowledge and services as they occur in the real world. The limitation of this project, actually it should be viewed instead as a new learning that will help enhance future iterations of OXIS calibration website. And calibration exercise is not static, with the future modifications will always be happening. To close, I would like to ask you all to do this one thing: register on this online framework and learn and calibrate directly from the masters on the fundamental change in etiology of dental caries. And that brings us to the end. Thank you so much for your interest and attention.